Good afternoon and welcome to Medicare Basics, sponsored by Hoag Hospital and the Hoag Medical Group and Hoag Physician Partners. The Hoag Medical Group and Hoag Physician Partners is an excellent team of doctors that provide internal medicine, family medicine, doctors of osteopath, and they have an excellent team of specialists to treat all your specialties. My name is Derek Tarvin, and I've had the honor and privilege of working with Hoag Hospital as an outside insurance consultant for over 25 years. And we help educate everybody on your Medicare options, the different Medicare plan choices. We can review your current medical coverage and compare that to individual Medicare options. And today we'll be going over what is Medicare, enrolling into Medicare, the two main plan choices for Medicare, which is a Medicare Advantage plan, which can be a Medicare Advantage HMO or Medicare Advantage PPO. And we'll discuss the Medicare Supplement Gap options, Medicare Part D, which is all where your Medicare prescriptions fall under that you fill at the pharmacy or mail order, extra help, and various enrollment timeframes. So what is Medicare? Medicare, also called Original Medicare, is health insurance for persons that are age 65 or older, or any that are under age 65 that have received disability benefits for 24 months. Or any persons that have end-stage renal disease or Lou Gehrig's disease. Medicare has four different parts. Part A is all your inpatient services. Part B of Medicare is where all your medical and outpatient coverage fall under. Part C is what they designate the Medicare Advantage, HMO or Medicare Advantage PPO. And Part D is where all the prescription drug coverage falls under. Only Medicare Parts A and Part B will appear on your red, white, and blue Medicare card. And when you receive it, there's an example on your screen, what you'll get after you enroll into Medicare. So Medicare Part A, this is where all your inpatient services fall under. Most do not pay a premium for Part A of Medicare. It was paid by you or a spouse through payroll taxes while working. It helps cover inpatient care in hospitals, skilled level nursing care, in nursing facilities, hospice, very limited medically necessary home health care, and more. Again, Part B of Medicare is where all your medical and outpatient charges fall under. Most people do pay a premium for Part B of Medicare. The standard premium for Part B of Medicare this year is $170.10 per month per individual. But it can be higher than that because Social Security bases your Medicare premiums on your tax returns. Part B of Medicare helps cover medically necessary doctor services, outpatient care, tests, durable medical equipment, limited home health care, preventative services, and more. And the different levels that one can pay for Part B of Medicare is up on your screen. And again, Social Security determines what your Part B of Medicare premiums are based on your tax returns. And they always look back 2 years as your modified adjusted gross. And in the year 22, if they look at your 20 tax return as your modified adjusted gross, and those that are individual filers that earn less than $91,000 or joint tax return less than $182, you'll pay the standard Medicare premium. If it's higher than that, they will charge you more for your Part B of Medicare based on your income from 2 years ago. The acronym is called IRMAA, or an income-related monthly adjustment amount. And the different levels that you can pay for your Medicare are on the screen for you to study, and it can go as high as this. The way that Medicare premiums for Part B are paid, if you're not drawing Social Security, they actually bill you by mail quarterly until if and when you start drawing Social Security. When you start drawing Social Security, or if you're drawing Social Security, they will automatically withdraw your Medicare premiums monthly automatically. Let me go back one slide. So if your income was higher 2 years ago and you go on Medicare currently and your income goes down and they're charging more based on 2 years ago, give Social Security a call and appeal it, and they most likely will lower your Medicare premiums based on your current status. Otherwise, they audit it every single year automatically. But again, 2 years ago, if your income was higher and they're charging their IRMAA, and 2022, your income has gone down, give Social Security a call and discuss your current status, and they most likely will lower your Medicare premiums automatically. Otherwise, again, they'll audit it every year automatically and can go up or down based upon your filings. So So to enroll into Medicare, Medicare usually starts on the first day of the month that you turn age 65. If you are receiving Social Security or railroad retirement benefits, you'll automatically get your Medicare card in the mail 3 months before your 65th birthday or the 25th month of receiving disability benefits. If you do not receive your Medicare card in the mail automatically and you're in these situations, give Social Security a call and say, where's my Medicare card? Those that are not receiving Social Security or railroad retirement benefits, you actually must enroll yourself into Medicare through Social Security. And there's a couple ways you can do that. You can contact Social Security. The number for the main office is on your screen, or you can go to SSA.gov or Medicare.gov. And if you go to SSA.gov on the home page, right on the home screen, there's a place where it says Medicare Enrollment. You click on that. That'll take you to another screen, scroll down, and it says Enroll into Medicare Only, and follow those steps. It's pretty straightforward. It takes about 10 or 15 minutes. But you can call Social Security and enroll them directly. I would advise calling your local Social Security office because they're a lot easier to get into than calling the main number. There is an initial enrollment period for enrolling into Medicare. You may enroll into Medicare 3 months before you turn 65, your birthday month, and up to 3 months after your birthday month. If you enroll within 3 months before your birthday month, Medicare will start on the first day of your birthday month. If you enroll during your birthday month or then 3 months after your birthday month, Medicare will start 1 to 3 months after signing up. There is a general enrollment period, if you miss the initial enrollment period, that occurs every January 1st to March 31st. And the coverage will start for Medicare on July 1st, and unfortunately, you may enroll a late enrollment penalty. Those that are covered by an employer-sponsored group health plan have different windows to enroll into Medicare Parts A and Part B. If you're covered by an employer-sponsored group health plan, and it is based on current employment with more than 20 employees, you can delay enrollment into Medicare Parts A and or Part B with no penalty. However, when employment ends or group coverage ends, whichever happens first, you have an 8-month window to enroll into Medicare Parts A and or Part B with no penalty. So again, if you're working and you're covered by employer-sponsored group health coverage or your spouse is, and there's more than 20 employees, you can delay Medicare Parts A and Part B with no penalty. Again, whichever happens first, if employment ends or group coverage ends, you have 8 months to enroll into Medicare with no penalty. Oftentimes, those that are employed and there's more than 20 employees covered by group insurance and become Medicare eligible enroll into Part A of Medicare because there's no premium for it, but do not enroll into Part B because they will charge a premium for that. If you do have Medicare Part A only and you delay your Part B of Medicare, later on there'll be 2 forms to fill out. One you fill out, one your employer fill out, and you submit those to Social Security and they enroll you into Part B of Medicare. Again, if you have more than 20 employees, you do not have to sign up for Medicare A and or Part B to become eligible. But again, when employment ends, you have 8 months to, or group insurance ends, you have 8 months to enroll in Medicare A and B with no penalty. Those that have enrolled into Medicare Part A and do not have Part B, when such time is necessary, again, there'll be 2 forms to fill out. One form you fill out, one you and your employer fill out, and you submit those to Social Security and they enroll into Part B of Medicare when such time is necessary. If you're covered by group insurance, actively employed, and there's less than 20 employees and become Medicare eligible, typically when there's less than 20 employees and you become eligible for Medicare, Medicare usually does become primary and you'll want to enroll into Medicare Parts A and Parts B. But if there's more than 20 employees, you can delay Medicare Part A and Part B with no penalty. And those that have Part A of Medicare only and the group insurance ends or the employment ends, again, there's 2 forms to fill out. One you fill out, one you and your employer fills out. You submit those to Social Security and they enroll you into Part B when such time is necessary. we can email you those forms in our office, or you can get those online from Social Security's website. Those that have a health savings account contribution and group health insurance is based on current employment, oftentimes you may not want to enroll in the Medicare Part A and or Part B because it have an effect on your taxes. So if you do have a health savings account contribution by your employer for your group coverage and there is more than 20 employees, oftentimes you do not want to enroll in the Part A of Medicare and definitely Part B. But always check with your benefits advisor or human resources to see how Medicare coordinates with your group insurance. Those that are covered by COBRA, unions, or retiree plans, or VA, once employment ends and you're still covered under the insurance, you want to make sure you enroll in the Medicare Parts A and Parts B within 8 months so you don't incur a penalty. Those that are covered by COBRA, the screen we need to change a little bit. So if you're covered by COBRA, a union or retiree plan, once employment ends, you have 8 months to enroll into Part A or Part B with no penalty. Even though you're still covered under the group insurance, employment has ended and you do not want to get a penalty for not enrolling into Medicare Part A and or Part B. Those that are covered by the VA and you do become Medicare eligible, you want to enroll within 3 months before your Medicare eligibility, the month of, or 3 months after to avoid a penalty. So those that are covered by COBRA, a union plan, a retiree plan, once employment ends, you've got 8 months to enroll into Medicare A and B with no penalty. Those that are covered by VA coverage and become Medicare eligible, you'll want to enroll during your initial enrollment period so you do not incur a penalty. If you have some more questions about this, please give us an email or shoot us a call. So now we're going to talk about the two main plan choices to go along with your Medicare Parts A and Part B. There are the Medicare Advantage plans, which can be a Medicare Advantage HMO or Medicare Advantage PPO. For the Medicare Advantage HMOs, most have a zero premium or very low premium, and the Part D drug coverage is included. The Medicare Advantage PPOs, 2 of them have a sizable premium, and there is one that is pretty reasonable as far as the premium. And the Part D drug coverage is also included into the Medicare Advantage PPO plans. We'll be discussing the Medicare Supplement Medigap plans next, after the HMO plans or PPO plans. And with the Medicare Advantage, with the Medicare Supplement plans, you do pay a monthly premium. And unfortunately, the Part D drug coverage with the supplements is not included, and you must purchase a standalone Part D drug plan to go along with your Medicare supplement. For either the Medicare Advantage plans or the Medicare Supplement plans, you must be enrolled in the Medicare Parts A and Part B to be eligible. So we're going to discuss the Medicare Advantage plans first, and they can be a Medicare Advantage HMO or Medicare Advantage PPO. They are also known as Medicare Part C. Medicare Advantage plans combined Medicare Parts A and Part B and the Part D drug coverage into one plan. Most Advantage plans do include extra coverage like vision, hearing. A lot of them have dental built in, and some of the plans, dental coverage is an optional premium. The Medicare Advantage plans, HMO or PPO, for each Medicare Advantage plan, they have different costs, co-payments, co-insurances, and yearly out-of-pocket maximums that you pay for your medical services before they cover you 100%. And the Part D drug coverage is incorporated into the benefits of the Advantage plans. The plans do cover you worldwide for emergencies and urgent needed services, and the benefits for the Advantage plans can change every single year. For the Medicare Advantage HMO plans, you must get your care from the plan's network providers and hospitals except for emergency urgent care situations. With the Medicare Advantage plans, you select a hospital, a medical group, and a primary care physician from the plan's network providers in your service area. And referrals for the Medicare Advantage plans are required to see specialists. So for Hoag Hospital, if you want to make sure you receive all your services through the Hoag Medical Group, the Hoag physicians, specialists, urgent cares, and facilities and hospitals, you'd want to choose your primary doctor from the Hoag Medical Group and Hoag Physician Partners. And that way, again, it ensures you receive all your services through Hoag doctors, Hoag specialists, and Hoag facilities. There are many different medical groups out there, and you can change your medical groups or primary doctors throughout the year of the Advantage plans. But again, if you want to access Hoag, all of Hoag, make sure you receive all your doctors and specialists and facility care through Hoag. Make sure you choose your doctor from the Hoag Medical Group. With the Advantage HMO plans, as we mentioned, most of them in Orange County have a zero or low monthly plan premium. You have your Medicare Part A and your Part B in effect, and always pay your Part B premiums. And then again, you will have co-payments or co-insurance for authorized services received from in-network or out-of-network providers when authorized. If you self-refer outside the medical group without a referral or besides emergency or urgent care, you must pay the full cost for non-authorized services. And as we mentioned earlier, the Part D drug coverage is included into the Advantage plan, so you don't need a separate policy. So as well as the Medicare Advantage HMOs, there are Medicare Advantage PPO plans. With the Medicare Advantage PPO plans, you use in-network providers or out-of-network providers that agree to accept the plan. Referrals are not required to see specialists, and you do pay a monthly premium for the Medicare Advantage PPO plans. With the Medicare Advantage PPO plans, you'll have deductibles, co-payments, and co-insurance for authorized services received in or out of network. If you refer yourself out of the network, typically you'll have higher co-payments, co-insurance amounts for out-of-network services. And the Part D drug coverage is included into the plan. So your other option for your Medicare plans to go along with the original Medicare Parts A and Parts B, opposite a Medicare Advantage plan, are a Medicare Supplement or Medigap plans. The Medicare Supplement plans supplement original Medicare and pay secondary to Medicare. With the Medicare Supplements or Medigap plans, you can choose any doctor, any facility, any specialist nationwide that takes Medicare patients. Referrals are not required to see specialists, and prior authorizations and approvals are not required. The Medicare Supplement plans have 10 standardized plans that are sold by various insurance companies. And for the Medicare Supplement Gap plans, different companies will charge different premiums for the same standardized Medicare Supplement plans. So with the Medicare Supplement plans, the medical benefits for, say, Plan G or Plan F are all identical. You can access all the same doctors, and they'll pay the same medical claims, but different companies for the Medicare Supplement plans will charge you different premiums for the same standardized Medicare Supplement plans. With the Medicare Supplement plans, you must have Medicare Part A and enrolled into Part B and paying your Part B premiums, but you will have additional premium for the Medicare Supplement. And unfortunately, the Part D prescription drug coverage for the medications that you fill at the pharmacy or mail order, you must purchase a standalone Part D drug plan, which is the third premium involved. The Medicare Supplement plans, or Medigap as they're also called, are what they call guaranteed renewable for life. They can never change the benefits of the plan or cancel the plan other than non-payment of premium. So the benefits for the Medicare supplements can never change, but unfortunately the premiums do go up to attained age. And you can change your Medicare supplement plans in the future. We'll go over the enrollment scenarios in a bit in the presentation. So the Medicare Part D is what your prescriptions fall under that you fill the pharmacy or mail order. The Medicare Part D coverage is available to anyone that has Medicare Part A or Part B. Medicare itself does not sell the prescription Part D drug plans. To get a Medicare Part D drug plan, you must enroll into a plan. And there are two ways to enroll into a plan to get your Part D prescription drug coverage. One is to purchase a standalone Part D drug plan that goes along with the Medicare supplement. And the Part D drug plans are sold by various Medicare approved companies. The individual Part D drug plans this year, there are 25 different drug plans you can choose from. With the Advantage plans, that is another way to get your Part D prescription drug coverage, is to enroll into a Medicare Advantage HMO or Medicare Advantage PPO that includes the Part D drug coverage into the plan. The Medicare Part D drug plans have different formulary and tiers that they list the medications under. The plans, again, will place the drugs into different formulary tiers, typically from 1 through 6 or 1 through 5. Each tier with the Part D drug plan has different co-payments and co-insurance amounts that you will pay. And they all tier the drugs differently. Not all the Medicare Part D individual plans cover the same medications or the same co-payments, and the different Advantage plans will cover your medications differently. How we make a recommendation for a drug plan, either the standalone Part D drug plans or those that are with the Advantage plans, is that we input your medications, and for the individual Part D drug plans that you purchase, we get a line-by-line itemization of all 25 drug plans and list them from which plan is least out-of-pocket annually to which is highest. And we can look up how the different Medicare Advantage plans cover your prescriptions as well, because they can vary quite a bit between the different companies. So with all the Medicare Advantage Part D drug plans, they have 4 different stages. The individual Part D drug plans that you purchase with the supplements have the 4 stages, as well as the Part D drug coverage with the Medicare Advantage plans. It's kind of confusing, the model, but you cannot get away from it. So stage 1 can be a deductible. And this year, the deductible for the Part D drug plans can be as high as $480. If it does have a deductible, typically you'll pay the full cost of your brand drugs and sometimes generics until you pay the $480 deductible. And as I mentioned, some drug plans may not have a deductible. So if you meet your deductible or that you're not of a deductible, then you go into stage 2, which is considered the initial coverage stage. And in the initial coverage stage for the Part D drug plans, you'll have co-payments or co-insurance for your drugs based on what formulary tier your prescriptions fall under, until the total cost of the drugs, the retail costs, exceed this coverage limit threshold, which this year is $4,430. So if you're in the initial coverage stage, stage 2, once the retail costs of the drugs exceed $4,430 this year, then you go to the next stage, which is the coverage gap, also known as the donut hole. And in the donut hole or coverage gap, you will pay 25% of the cost of generic drugs or 25% of the full cost of the brand drugs until you reach the coverage gap limit this year, which is $7,050. If you exceed $7,050 in the coverage gap, then you go into the next stage this year, also known as the catastrophic stage. So if you reach the catastrophic stage this year, you will pay $395 for generics, $985 for brand drugs, or 5%, whichever is greater. And then unfortunately, January 1st of next year, it all resets, these figures all change, and you start back at stage 1. So let me go back a couple slides here. So when in the initial coverage stage, once the retail cost of the drugs exceed $4,430, then you go into the coverage gap, also known as the donut hole. And when you're in the donut hole or coverage gap, what contributes towards that $7,050 and gets you into the catastrophic stage is any co-payments you pay in stage 1, 2, or 3. And when you're in stage 3, the manufacturer for most brand drugs pays the other 75% contributed towards that $7,050. So once you contribute what you've contributed in the first 3 stages, and the manufacturer contributes in the coverage gap for brand drugs towards that $7,050, then you go into the catastrophic coverage stage. I know it's very confusing, but you cannot get away from these 4 coverage stages. If you have some questions about this, please give us a call or send us an email. Unfortunately, those that pay more for your Part B of Medicare for IRMAA will pay more for your Part D prescription drug plans. The income-related monthly adjustment amount is applied to the Part B and also the Part D. They shake the trees any way they can to get their money. So 2 years ago, if your modified adjusted gross in your tax return for individuals higher than $91,000 or higher than those that file a joint of $182,000, you'll pay more for your Part B of Medicare and also your Part D drug plan. And the different levels that one can pay are on your screen for Part D, and it can go as high as this. And again, they audit it every single year. So your Medicare premiums for Part B and Part D can go up or down based upon your filings. And this year, if your income is lower than 2 years ago, give Social Security a call and discuss that, and they most likely will lower your Medicare premiums based on your current status. Otherwise, they'll audit it every single year. So there is a Part D late enrollment penalty if you delay or have a break in continuous drug coverage for 63 days or more and you don't have other credible coverage. When you enroll into Part D of Medicare, they will assess a premium for life, unfortunately. It's not a big premium, but it can accrue and it's more of a nuisance. The penalty is 1% of the national average base premium multiplied by every month that you're uncovered. So the average national base premium is around $35. So let's say you go 24 months without having Part D drug coverage and enroll into it. I believe the premium would be like 24% of $35, which is around $8.40. That'll be tacked on to any monthly premium for life. So it's a good idea if you have a supplement to enroll in some Part D drug plan. With the Advantage plans, most of them have the drug coverage. You don't have to worry about it. There is extra help. This is a Medicare program that helps people with limited income and resources pay for Medicare drug costs, also called limited income subsidy. It can help pay monthly plan premiums, deductibles, co-insurance, or co-payments. If you think you qualify for this, give Social Security a call and discuss your current financial status with them. So now we're going to discuss the different enrollment timeframes to enroll into the supplements, the Advantage plans, and the Part D drug coverage. There is an initial election period, turning 65 or new to Medicare. There is a special election period based on different scenarios, such as leaving employer-sponsored group health coverage, a permanent move, a 12-month trial basis. The annual election period that occurs every October 15th through December 7th, which applies to Medicare Advantage plans and Part D drug plans only, not the Medicare Supplement plans. And there's a newer enrollment period called the Medicare Advantage Open Enrollment Period for existing Medicare Advantage plan members only. So the initial election period is when you turn 65 or new to Medicare. If you would like to enroll into a Medicare Supplement plan or Medigap, you have guaranteed issue where they do not ask any health questions for 3 months before you turn 65, the month of, up to 6 months after your Part B of Medicare goes into effect. So if you'd like to enroll into Medicare Supplement, you have 3 months before your Medicare effective date goes on, up to 6 months after your Part B Medicare effective date, where you will not have any health questions and they cannot turn you down based on health. Is called guaranteed issue. The initial election period for turning 65 or new to Medicare, enrolling into a Medicare Advantage HMO or PPO, you may enroll into a Medicare Advantage HMO or PPO 3 months before your Medicare Part A and Part B go into effect, up to 3 months after with no health questions. The same time frame applies to the Part D drug plans as the Advantage plans. You have 3 months before, up to 3 months after your Medicare Part A and Part B effective date occurs, whichever happens first with no health questions. And the Part D drug plans and the Advantage plans do not have any health questions for them. There are special election periods for those that are leaving employer-sponsored group health plans. If you'd like to enroll into a Medicare Supplement plan or Medigap, you have guaranteed issue, no health questions, up to 63 days after your group insurance terminates, unless you're new to Part B of Medicare. Then you have 6 months. And to enroll into a Medicare Supplement plan, again, you must have Medicare Parts A and Part B. Most people are going to coordinate their group insurance to start the day after it terminates, but if you do happen to miss that, you do have 63 days to enroll into Medicare Supplement, even if your Medicare A and B has been in effect for years. Or if you're new to Part B of Medicare, you have 6 months after your group insurance terminates to enroll into a Medicare Supplement, no health questions, and you must be in Part A of Medicare as well. So for the Medicare Advantage plans, the HMO or Medicare Advantage PPOs, if your group coverage ends, you have 2 months after your group coverage ends to enroll into a Medicare Advantage plan. And you must have Medicare Parts A and Part B. And the Part D drug plans as well, once group insurance terminates, you have 2 months to enroll into a Medicare Part D drug plan. The supplements, for some reason, have 63 days, but the Advantage plans or the Part D drug plans have 60 days to enroll once group insurance terminates. There are other enrollment scenarios, a 12-month trial right. If you enroll into a Medicare Advantage plan when you first turn 65 and new to Medicare, they'll give you a 12-month trial basis to try the Advantage plan out. If for any reason during that initial 12 months you're not happy with the Advantage plan or simply want to get a Medicare supplement for whatever reason, they'll give you a special enrollment period anytime during 12 months to terminate the Advantage plan and enroll into a Medicare supplement and a drug plan with no health questions. Those that have a Medicare supplement plan and want to enroll into a Medicare Advantage plan for the first time later on in the future, they will give you the 12-month trial basis as to enroll into a Medicare Advantage plan out of a Medicare supplement for the very first time. So if you have a Medicare supplement plan and enroll into a Medicare Advantage plan for the first time, they will give you that 12-month trial basis as well. If you're not happy with the Advantage plan or simply want to get your Medicare supplement back for whatever reason, they'll give you that special enrollment period to terminate it any time during a year and enroll into back to your Medicare supplement, no health questions. They don't give you both 12-month trial basis. They give you one or the other, but it's nice that they do that. The annual election period, this occurs every October 15th through December 7th. We get real busy in our office during this time frame, reviewing our clients' Part D drug plans for the upcoming year or the Advantage plans. The drug coverages for the Advantage plans can change, and the benefits for the Advantage plan can change. If you have a Part D drug plan standalone with a supplement or an Advantage plan, we highly recommend reviewing or having us review the drug coverage for the upcoming year. It can change drastically. So the annual election period is the time frame that you can enroll, disenroll, or switch your Medicare Advantage plan or your Part D standalone drug plan that you purchase with a Medicare supplement. The Medicare supplement plans do not go through this time frame. If you make a change during this time frame, the new plan will start January 1 or terminate January 1. This is a newer time frame that you can make a change to your existing Medicare Advantage plan during the Medicare Advantage open enrollment period. This occurs every January 1st through March 31st. If you have a Medicare Advantage plan, you can actually change your Advantage plan once during this time frame to a different Advantage plan. No one knows about this time frame really because no one can advertise it and they can't target you. But again, this is for existing Medicare Advantage plan members only, that you can change your Advantage plan once during this time frame. So let's say you didn't review or have us review your drug coverage during the annual enrollment period of October 15th through December 7th, and you go to the pharmacy and your medication is not covered or is very expensive, you can review the other Advantage plans to see who they're covering them more cost effectively. Or those that have a Medicare Advantage plan, you can disenroll your Medicare Advantage plan during this time frame, enroll into a Medicare supplement and a Part D drug plan. If you're going to use this time frame to enroll into a Medicare Advantage plan and a Part D drug plan, we highly recommend applying for the Medicare supplement plan and make sure they accept you during this time frame because they can deny you based on health. And if you enroll into a Part D drug plan, it'll automatically cancel your coverage the following month, and we don't ever want to leave any without medical insurance. So if you have a Medicare Advantage plan and want to apply for Medicare supplement during this time frame, we highly advise applying for the Medicare supplement before enrolling into a drug plan. Make sure you get approved by the Medicare supplement and then enroll into a Part D drug plan. The Part D drug plan, again, will cancel your Medicare Advantage automatically the following month. But if you want to switch your Advantage plan to a different company, There's no health questions, and if you make the change to a different Advantage plan in January, the new Advantage plan becomes effective February, March, and April. There is one other situation for the Medicare supplement plans that you can switch. Let's say you move out of your county if you have a Medicare Advantage plan. The Medicare Advantage plans are typically county to county. So if you move out of the county or the state, you have a guaranteed window to enroll into any Medicare Advantage plan in that area or into a Medicare supplement, no health questions. There are other scenarios for the Medicare supplement plans that may apply, but we went over the major ones. I know we had a lot of information. We'll take some questions now. If you have any other questions or would like to set up an appointment in our office, we don't ever charge a fee. We have a local office in Costa Mesa. We have a family business, and we'd be glad to hear from you. So let's see. So since the Part D is so confusing, it seems Medicare is pushing us to Medicare Advantage plans. Thoughts? Well, that's one theory. I don't know if Medicare is pushing people into Advantage plans, that there are many different choices. The Part D Advantage drug coverage, the model is exactly the same for the standalone Part D drug plans or those that have Advantage plans. The individual Part D drug plans that you purchase that goes along with the Medicare supplement or those that are integrated into the benefits all have the same coverage model, the same stages. So I know it's very confusing. If you have some questions, please give me an email or give us a call. But yeah, it's the same coverage model for the Part D drug plans, whether it's purchased standalone with a supplement or integrated into the Advantage plans. Is there an age limit that you have to enroll into Medicare? Typically, Medicare A and B, you're eligible for the first day of the month that you turn 65. If your birthday falls on the first, then they would backdate your Medicare eligibility 1 month. Those that are covered by employee-sponsored group health plans have different windows to enroll into Medicare. And you can enroll into early Medicare through disability if you're receiving Social Security disability benefits for 24 months. The 25th month, you're automatically enrolled into Medicare. And those that have Lou Gehrig's disease or end-stage renal disease are eligible for Medicare at any age. So it can vary based upon your your situation, but typically it is the month that you turn age 65, you're eligible the first of that month, or if you're new to Medicare and your birthday falls on the first, turning 65, they actually backdate your Medicare eligibility 1 month. I'm not sure if we have any more questions. Well, you must have been in a very attentive office. Again, if you do have any questions or like any help, please contact us by email or give us a call. And we do have a Medicare supplement comparison chart that we can email you or Hope can email you that shows you what your Medicare A and B benefits are, the various Medicare supplements that are on there for comparison, and that has the various enrollment timeframes as well. And we will be discussing the Medicare supplement plans more in detail this Saturday if you'd like to register for the class, and I believe it's at 10 a.m. this Saturday. Well, thank you for attending. You guys have a wonderful afternoon. Stay healthy, and thanks for attending. Bye-bye.